Hi everyone. Today we're going to discuss a few things about cultural competency or what is trying to understand what is cultural competency when it comes to practicing as a clinical psychologist. Okay, so in the past or in earlier days, cultural sensitivity or cultural responsiveness or multicultural competence. So these were the terms which commonly used to convey the significance of or importance of attending cultural issues when it comes to therapy or in a therapeutic relationship or when it comes to counseling. So basically, now APA has put an effort to identify, or maybe I can say that to clearly define what cultural competency means and how a psychologist or a counselor should practice, should be culturally, how much it is important to for a counselor or psychologist to be culturally competent. So APA put an effort. So according to APA loosely defined cultural competence as a ability to understand or to appreciate and interact with people from cultures or belief system different from one's own. So basically your ability as an individual or as a therapist or as a counselor, your ability to understand about different culture which is different from yours. Okay, so your ability about understand about different cultures and your ability to appreciate different culture or people who hold a different belief system from which is different, totally different from yours. Okay, so your ability to interact with such people, your ability to appreciate their culture, accepting their culture and understanding that is what now APA call it, or APA, that's how APA loosely define cultural competence. So this is cultural competency is a very key aspect of psychological practice for over a period of time, and it becomes such an integral part of the field that it is listed as one of psychology's core competencies. APA has listed a number of core competencies for a psychologist, and this has, over the period of time, it has gained so much of importance because it is very important when you establish a therapeutical relationship, even when you offer service also. It is very important for a clinician to understand the cultural background of the client. So that is the reason why APA has included it as one of the core competency in psychology. So basically now before going further, what is competency, by the way? So competency is something we can say that it's an ability to perform a task or the quality of being adequately prepared or qualified. If a therapist or a counselor are generally competent to conduct psychotherapy, they should be able to demonstrate their skills with a range of culturally diverse clients. So that is how we can say it. So proponents of cultural competency, however, they believe that competency is largely a relative skill or a relative quality, this which depends on one's cultural expertise and orientation. So as a clinician, we should put effort to understand and appreciate, to learn and understand about different cultures which is around the globe. So in cultural competence, it's important to distinguish between three level of analysis. They mention three level of analysis. One is provider and treatment level, and another one is agency or institutional level, or another one is system level. So provider level, which means which is the basic level, the therapist and the counselor, who is providing the service or treatment. Provider level, their cultural competencies has to be established, and even in agency or institutional level, for example, the operations of a mental health agency. So if there is a mental health agency or mental health institution which offers services, this institution also should be culturally competent enough. And also another level talks about system level, where systems of care in a community, or systems which is meant to take care of a community, those systems also should be culturally competent. There should people who are part of the system should be culturally competent. They should have understanding about different cultures. They should have understanding about, or they should have the ability to appreciate different culture. So that is system level. So majorly as a clinician, or majorly as a counselor, our focus is mainly on the first level, whereas it is in the provider level. So where a therapist or a counselor, we used to provide specific treatment, that counselor or therapist should be culturally oriented, so that they can provide good service to the diverse client who approach them. So there are so many studies talks about the importance of cultural competency. So I want to mention about one of the recent. There are so many studies conducted in the field which talk to understand the importance of cultural competency. One of such research talks about the research by D.W. Su and his colleagues. It talks about it talks about, as a culturally competent counselor or a psychologist, what all things we should be having. So it argues that the culturally competent counselor has these certain types of skills. So one thing which they talk about is that cultural awareness and beliefs. So they believe that culturally, when you say that a counselor is culturally competent, he or she should be aware about different cultures and different beliefs. So the provider, or the service provider, which is a counselor or a psychologist, should be sensitive to her or his personal values and biases. They should be and how these biases or their personal values influence the perception of the client and the client's problem and the counseling relationship. This much understanding should be there. And another major important thing which is put forward by these researchers is that cultural knowledge of counselor or a psychologist, which talks about the counselor or the psychologist should be having knowledge of the client's culture. That is very important when you provide service for the client. So client's culture, client's worldview, and the expectation of a client from a counselor relationship, or from their therapeutic relationship. And another important point which they note down is that a culturally competent psychologist will be having cultural skills. So when they say cultural skills, it is the counselor or the psychologist has the ability to intervene in a manner that is culturally sensitive and relevant. So that is, we cannot impose our own things to that. We should be, whenever you intervene, you should intervene in a manner which is culturally sensitive and culturally relevant. So cultural competency involved the constellation of the right personal characteristics which involve an awareness, knowledge, and skills that a counselor or therapist should have. So every therapist is responsible to be a culturally competent professional. Thank you.